Welcome to The Wire. I'm Raghu Karnad. Like me, many of you will be staying firmly inside your homes these days to observe the lockdown, but also because we are afraid. We're afraid of an insidious new variant of the coronavirus. We're afraid of a second wave, which has gone completely out of control in our country. And we are especially afraid that if we get sick or our families do, there will be no route, no hope of a hospital bed or the medical care that we need. But at the same time, every single day, there are people out there, essential workers, relief volunteers, and medical staff who are specifically reaching out to people who are infected and sick to offer them whatever comfort and medical care is in their power. I want to start by reading the words of a representative medical worker, a nurse at the LNJP hospital in New Delhi. These are his words. A 1,500-bed hospital. Not a single bed has been vacant in it for days. New patients arrive when a bed is empty. I've been on duty for weeks in a 40-bed COVID ward, and the duty in a ward is for 2 nurses. When I go on duty at 8 in the morning, I don't have time to even rest until 2 in the afternoon. Cylinders in the oxygen beds need to be checked regularly. Patients need to be given medication. Patients need to be assisted with primary care. Some patients may be unconscious and they throw off their oxygen masks. Patients need to be helped to eat. 2 people for all of this. And all of this work is done in a PPE kit in the scorching heat of Delhi. 1 or 2 patients die in every shift. Once the doctors have issued their certificate, it's our job to document it, and then relatives and police need to be informed. Arrangements need to be made to send the bodies to the mortuary. Many patients who make good progress in the morning rounds end up in critical condition in the afternoon, and they die. I had a similar experience yesterday. This is still the nurse's words. I had a similar experience yesterday. I saw a patient in the morning and talked to him. He was feeling better, and I helped him to go to the bathroom. I gave him water. Sometime later, when I came to give him the injection, I heard that he had died. In such cases, I almost collapse. Families often contact us on the phone for information. We have a duty to comfort them too. Many people call for a bed, but we have to clasp our hands in defeat. So this is a small window into the daily experience of nurses, Indian nurses in the middle of, or rather at the start of our second wave. This is a nurse who's serving at LNJP Hospital in New Delhi, who spoke to Malayalam Manorama this week. And incidentally, he also happened to be observing Ramzan and going home every day to a wife who's pregnant. Probably no one is taking on more risk, longer hours of exposure, or a heavier burden of physical, emotional, psychological demands than Indian nurses right now. They're working in hard conditions, wearing PPE all day long, watching patients die on every shift. There is a very serious problem here. First, that our nurses are not properly compensated or thanked for serving in the front line of the front line. And second, that there are far too few of them. We might be at the start of India's second wave, which is now the worst COVID crisis in the world, but India's nurses are already exhausted and stretched beyond their maximum endurance. So what is it we should be doing for them? And what should we be doing to save our own lives? To help me understand the challenges faced by Indian nurses and the danger of our shortage of them during the second wave, I'm speaking to Usha Krishna Kumar, who is the president of the Nurses Welfare Association of India, based in Delhi. Ushaji, thanks for joining us. Can you help us understand, at least those of us who have been lucky enough to not yet see the inside of a COVID-19 ward, help us understand what the work and the challenges are of nurses at this moment, and also how it differs from that faced by doctors.
Yeah, hi Raghu, thanks. I want to go straight to the topic. Nurses are the ones who doctors go in and prescribe the medication. And the nurses have to carry out, they are there throughout for 4 hours or 6 hours. It differs from hospital to hospital. You see, doctors and the disparity in payment also is there. Even in a vaccination center, the doctor is paid 1 lakh and the nurses who give the jabs actually are paid only 20,000. This is, I'm talking about government. And otherwise also they say that after their duty, they are not given, they are given a choice to either have an accommodation for quarantine because they will be putting their family in danger.
Yes.
So the doctors are given 5-star hotels, and these nurses are given alternative places where, it's sometimes closed down hotels, it's not functioning properly, and they have to go there. It's very dusty. They are not given a good environment at all.
Yeah. And
And
that stems from just this the prior situation in which nurses just don't they are denied a lot of the respect and the prestige that they're due for the work that they do, because after all it's nurses who care for patients and who actually have to administer most of their medical care while doctors do consultations, of course.
right, Raghu, in India, that has been the biggest issue actually, that we have not recognized their work, their profession, their noble profession. We don't give them the respect and status in society that is required.
Yeah.
Whereas when they go abroad, if you go anywhere in the world, you will find that nurses are treated far better. They are, in fact, treated equally to the doctors. Here we find there's so much disparity and running them down. They're not even treated properly in some of the hospitals where the workers, the general duty ward boys are given. Even the ward boys, run them down and order them. Contractual nurses has been working from 2016 in hospitals like Safdarjung, RML, all the well-known hospitals in Delhi under the government, and they find that they are working much more than the other nurses in the COVID wards.
I think many people who rely on medical services don't have any idea that first nurses, their salary can be as low as 20,000 per month, which is, I think,
Some
very low.
hospitals are giving even 15,000. That is, private hospitals are giving 15,000. Some places, of course, some Apollo Max and all are giving 25,000. But that's pittance in a cosmopolitan city like this.
Yes.
And they're doing work for, it's supposed to be 8 hours, but it stretches to 10 to 12 hours.
So they're paid a pittance, and many of them are then recruited on contract so that they don't have the same protection of their tenure and pension and so on. And in addition to that, now that we are in this drastic situation, their work conditions have become much more difficult because they have to spend their entire working shift wearing PPE, facing the risk of being in the proximity of infectious people. And there's, as nurses, I've been reading some testimonials of nurses in especially in the Malayali press, and there's incredible difficulty that comes with just being in PPE while all day long while you do your work. You can't use the bathroom, you can't eat a snack.
Exactly, you can't have something to drink. No, they don't.
That's right. You can't change your sanitary pad if you need to do that. There's just a variety of things, and they have to undergo that discomfort. And it seems just quite shocking that that all of that comes with such a pathetic pay scale.
Mm.
So,
But So what I'm trying to say is they have always been facing all these problems even without the COVID situation.
Right.
If they are in the OT or if they are doing a duty, they are not given anything to, they are not able to take time for even for a coffee break or tea break, or they are always overworked and overburdened, and now especially much more.
The majority of nurses, I believe, are women. There's probably an additional burden and responsibility in their lives that awaits them at home, domestic responsibilities. And now, mixed up with all of that, with their responsibilities to their family, is the risk of infecting their families, because their families might not have qualified for the vaccine, their children or their siblings. And if their families are infected, then they also have to care for their families. So there must be unimaginable demands on them, even outside of their working shift. I was just reading one of these testimonials in Malayalam Manorama talks about an assistant nursing superintendent whose sister and brother both got infected, and then both of them died. And so there's this incredible emotional burden that probably comes with doing this work and subjecting your family to the risk right now.
That's right, Raghu. There has been many instances like this, and many of the nurses have been saying that their husbands have been infected, their children have been infected, and they have, had additional responsibility of taking care of them also, and of course, so these are many of the problems that they are facing, and there are many of them who have also uh, died during this COVID because they themselves have got infected.
Yeah.
So there is no surety, even the vaccine has not helped them, to
Yeah.
be frank.
I was surprised to see that the Trained Nurses Association of India has been sharing images and the names and photographs of nursing sisters who've passed away even as recently as the last few weeks. And these are all people who would have gotten the vaccination.
There has been a huge number of nurses passing away, actually, though I don't have the actual data now to give you and let you know how many nurses have passed away. Many people, and they all suffer, and they really have to cope up with the situation because they are committed to their profession.
Ma'am, earlier you mentioned the scene at the vaccination centers where it's the nurse who actually delivers the injection again and again. Actually, I just got my first jab. I was quite lucky to find a slot, and I got my first jab yesterday, which is partly I'm suffering some of the symptoms right now, which are just side effects, thank God. But yeah, I noticed that it was, that the consultant is there, the doctor is there and seated at a desk, and it's the nurse who has to approach patient after patient after patient to deliver the jab. And that's just one very small window into how nurses are doing backbreaking labor and who are the ones who are actually delivering the care in many respects, who are actually delivering medications, both in the case of vaccinations, but also in the case of everyone who's actually sick. So coming to the comments, the remarks by Dr. Devi Shetty that got a lot of attention. He pointed out that right now, India is rightly and understandably focused on the shortage of medical resources, that there's not enough oxygen, that there's not enough hospital beds, that there's not enough remdesivir and other drugs, and there's just that the floor has kind of fallen out in terms of medical goods. What he pointed out is that you can fix that problem comparatively easily. It's relatively easy to get more oxygen and to get more goods. But the larger problem, as we're just at the start of the second wave possibly, is the people who actually provide the care. because after all, it's not just oxygen that's making you better. Oxygen is just keeping you alive so that medical professionals can then step in and administer your treatment. And here we are in a country where nurses in particular are already exhausted and overburdened, and we're just entering the worst phase now. And he pointed out, I'll just quote a line. He said, "The real workers in managing COVID patients successfully in ICU are not the doctors; they are the nurses." And he said, before this COVID started, government hospitals across the country had a shortage of 78%, of medical specialists. So we need to produce at least 2 lakh doctors, 2 lakh nurses and 1.5 lakh doctors in the next few weeks who are dedicated to managing COVID for the next 1 year. So that's a very drastic assessment of where we stand right now. It calls for really emergency actions. Tell me, can you expand on what he said about the remedy for this situation, and tell me what's your whether you agree with that remedy and with his assessment?
Yes, to some extent, I agree. There are many nurses who have passed out, and doctors, especially doctors, he mentioned, absolutely right, those who have come back from abroad and they are sitting and trying to do the exams. The nurses also, there are many nurses who are preparing for exams to go abroad. And if they are given a choice to work in a government hospital, I'm sure if the central government offers them, if the government, not only center, state, whatever, if they are offered very good, that they'll be given certificates and they'll be assured a job here in a hospital. And then, for 1 year, if they work, it'll be a good thing, especially those nurses who have passed out. But they may lack experience. So there should be a supportive system to the nurses already working in these, maybe putting 2 nurses with one of the experienced nurses will help the situation out. Then there are instances where nurses in Madhya Pradesh, especially, I believe they have appeared for exams in 2019 and they have passed out, but they have not been given their certificates. So they are doing jobs for 6,000 rupees and all. Somewhere, some people are not doing any job because they don't have the certificate. So these nurses also can be called in to come and, work for the hospitals.
Yeah. So one would have thought that a lot of these measures would have been examined and rolled out sooner, if not 1 year ago, or if not 6 months ago, when we thought that the worst had passed. Even 1 month ago, it was clear that the second wave was coming, and now I think just in the last day or two, the government has picked up on some of Dr. Shetty's recommendations. And they may, some nurses who are at the end of their GNM degree, who have not completed their exam, they might be asked to start providing clinical care soon. Shajit, as you pointed out, many of these new nursing staff will be quite inexperienced. That comes with the issue of their meeting kind of clinical work standards, of course, but it also comes with the issue of their own vulnerabilities. So, for instance, the stories I've been hearing from nurses in COVID-19 wards especially in New Delhi, is that, for instance, as you said, some of them are 2 nurses working a full shift for a ward of 40, 50 people. And they say that in each shift, someone dies. In every shift, one of their patients dies. Now, sitting where I am, I cannot imagine how difficult that is psychologically how traumatizing that is. To be interacting with people who are relying on you for care, who you don't have the personal and the personal wherewithal nor the medical resources necessarily, and you're encountering death every single day, week on week on week. It sounds truly like they must be having post-traumatic stress, or worse. And I just don't. I mean, I understand that I've been hearing people saluting nurses as heroes, but I haven't heard many practical solutions to really address what is surely a mental health crisis that is coming up for doctors and nurses after this pandemic crisis.
We can ease their mental trauma by letting them be in a better environment. And I think private hospitals are really bad condition because they are given 15,000 to 20,000 as starting. It depends on various hospitals. And of course, good hospitals like Max and Apollo are giving 25, but that's again nothing.
That's nothing.
Delhi government has laid down that the basic salary of a maid has to be 15,000.
That's right. Yeah.
So we all pay 15,000 to the maid, but imagine a nurse who have studied for 4 years and getting paid 15,000 is ridiculous, and they all come from economically very poor background. So, and then again, most of them have taken educational loans. These are some of the fronts I've been fighting for.
Right.
And I feel Dr. Shetty said it's a war, it's a COVID war. Why can't they treat it on par with the defense personnel?
Yes, exactly.
Give value to whatever work they are doing. It's as important as fighting in the border.
Yeah. If after this crisis and this experience, we can't recognize how important their role is and how much they deserve to be rewarded and recognized for it, then that's going to be another tragedy of its own. Thank you so much, Usha ji. It was really helpful to speak to you and to understand how it is we should be supporting the people who are in the front line of the front line and who are saving so many Indian lives right now. Thank you.
Thank you, Raghu.
To receive instant updates on all videos from The Wire, click the subscribe button and hit the bell icon. Pay to support independent journalism. Click the link in the description and choose the amount you want to pay.